I am Dr. Priyankar. I am a pediatrician. I am a professor at the Institute of Child Health, Kolkata, and I am also a pediatric rheumatologist. I am the HOD of the Pediatric Rheumatology Department of the Institute of Child Health at Kolkata. So, today we will be discussing on childhood arthritis. Now, this question often arises, do children develop arthritis other than infective arthritis? A lot of people are, when we say that your child has arthritis, they say, so arthritis happens only in adults. It's a disease of the elderly population. But definitely children also do develop arthritis. It's not very common as in adults, but the disease definitely exists. So, what is childhood arthritis? The medical term for childhood arthritis is juvenile idiopathic arthritis. That is a common variety of arthritis. Of course, you can have other diseases, other immunological diseases like SLE, other connective tissue disorders which can present with arthritis, but usually it is a juvenile idiopathic arthritis. So, what we mean by juvenile? So, the patient has to be less than 16 years of age at the onset of arthritis. And any age group? Yes, any age group less than 16 years. So, we have encountered children less than 1 year also presenting with arthritis. What about idiopathic? Idiopathic means the cause is not known. So, there are a lot of diseases in medicine where it is idiopathic. We know how to diagnose the disease. Of course, we have named the disease. We know the pathology, the pathogenesis, but we really do not know the exact cause of the disease. So, it is an idiopathic disease. It is a disease of the immune system of the body. So, now the immune system is normally there to protect you. So, it is there to protect you from outside infections. So, in an immunological disease, what happens? The immune system runs amok. So, instead of protecting you, it starts attacking the body itself. The T cells, the B cells, they start attacking the body itself. So, that is an immunological disease. And arthritis means, so there is a joint swelling, there is pain, there is restriction of movement, and occasionally you can have some redness of the joints. So, this is what you call a juvenile idiopathic arthritis. Now, what are the symptoms of juvenile idiopathic arthritis? So, if a child is big enough, the child can complain of a joint pain or a joint stiffness, difficulty in moving the joint. But if you have a small little baby, a child less than 1 year of age, so how do you understand? Now, if the child is able to move around, you can notice a limp. So, the child is limping. So, and if you examine the joint properly, you can come up with evidence of a joint swelling or a joint pain in one of the joints. Then there can be a morning stiffness. So, the children when they arise from the bed, they used to run around after getting up from bed. Now, suddenly the child is not wanting to get up from the bed. The child is having difficulty in getting out of the bed. So, that is what you call a morning stiffness. Now, what are the varieties of arthritis? So, you can have the oligoarticular GIA, which can affect 1 or 2 joints. Then you can have a polyarticular, where 5 or more joints are affected. You can have a enthesitis related arthritis, which happens in usually a little older boys. It starts off with a peripheral joint swelling, the knees, the ankles, and then subsequently it goes on to affect the spine. So, you can have the spondyloarthropathies. You can have a psoriatic arthritis, which of course is not very common. There is a mixed variety, and one of the commonest is the systemic arthritis. This systemic variety of arthritis, some of the scientists will call it an autoinflammatory disease, but till now we call it a systemic arthritis. So it presents with systemic symptoms. What are the systemic symptoms? So you have fever. So majority of the arthritis, they just present with joint pain, stiffness, joint swelling. But here you have an arthritis which is presenting with fever. So the child may have very high temperatures. There may be arthritis, there may not be arthritis. But along with the fever, if the doctor does a blood test, they see that the blood counts are going up. So the total count, the neutrophils, the ESR, the CRPs, they are rising. But along with that also there is a rise in the platelets. So then you suspect that is not an infection. So before going on stepping up antibiotics, one has to consider whether we are dealing really with an infection or is it an inflammation that we are dealing with. So they can have very similar presentations. The cultures are negative, you cannot localize the site of infection. So then you start thinking whether this is really infection or is it a systemic arthritis that we are dealing with. Diagnosis, there are not much of fancy tests for coming to a diagnosis. It's usually a very, very clinical diagnosis. So it's a clinician's domain that you can say that dealing with arthritis and diagnosing arthritis. So the investigations are more to either categorize the disease or to rule out other diseases which can present with arthritis, but they are really not arthritis, like sometimes childhood malignancies. Very common is the childhood leukemia, the acute lymphoblastic leukemia. So that is one of the notorious diseases which can present just with arthritis without any other manifestation. So investigations are basically to rule out all these other diseases, and regarding treatment, one should definitely consult a rheumatologist, better a pediatric rheumatologist. So because they are the people who are apt in dealing with children. So there are lots of drugs nowadays, steroids, then NSAIDs. Methotrexate is one of the most beautiful drugs. It's a drug which has done wonders over last 20-30 years. It's a safe drug. A lot of people are afraid of methotrexate, but it is a safe drug in the dose that we use in arthritis. And then again, if the methotrexate fails, then you have other medications nowadays which are known as the biologics. Again, they are beautiful medications. They are like almost wonder drugs. But the most important thing is to diagnose properly and treat the disease. So if you don't treat the disease, the child may develop crippling contractures of the joints. So if a child is developing crippling contractures of the joints, so his lifestyle may be modified, his productivity in the later years may be jeopardized. So it's very important to properly diagnose and treat the condition, definitely, possibly by a pediatric rheumatologist. Thank you.